The Johns Hopkins Children's Center actually evolved out of a will that Harriet Lane wrote back in the early 1900s. She was the first lady of the United States under Buchanan. She was Buchanan's niece. She moved to Baltimore after Buchanan stepped down and married someone named Johnston. They had 2 children. Both boys died of rheumatic heart disease when they were teenagers. And so she bequeathed the entire estate to the formation of a children's hospital. And out of that grew the Harriet Lane home, which was a 4-story building on the original campus here at Hopkins. It was the first children's hospital that was associated with a medical school and a university hospital. It opened in 1912. From the very beginning, it was a place where the faculty here were committed not only to giving state-of-the-art of care, but actually changing care. The first cardiac surgery in the world on a live beating heart was done at Johns Hopkins. The therapy for vitamin D and rickets became apparent here. We're trying new forms of therapy for cystic fibrosis here. We developed the new therapy for sickle cell disease. I can't name a specialty in which something wasn't originated here. I think what the new genetic revolution is teaching us now is we also have an opportunity to actually begin to figure out how we might prevent adult onset diseases. The idea is to develop groups of experts, both young and old, that will go out and actually make changes far beyond our imaginations. 2 towers are beginning to rise out of the ground now. One tower will be a new children's hospital, which will take care of only children. And then another tower will be the adult hospital. And in between, at least for the first 5 floors, there'll be connections. By building these towers together and putting the very best equipment and the very brightest people taking care of children's and adult right next to each other, we'll be able to rapidly translate a lot of new things, a lot of new technological developments much faster. We can have rooms that'll be flexible enough to be an intensive care unit 1 hour, or several hours later just be a recovery area. And we're developing rooms that actually have that flexibility built into them. We have a new burn unit being developed here, which will have specialized equipment in it for the burn patients. We'll have new floors for infants with a variety of both infectious diseases but genetic diseases, all of which will be single rooms where families will be able to stay with them. Having the very best facility is going to attract the very best doctors. And at Hopkins, we want the doctors who are going to be committed to actually doing the research and bringing it rapidly to the bedside. My dream is this will become the most important intersection in pediatrics in the world.
When there's great research driving clinical care, we're going to have state-of-the-art care, and we're going to have the best outcomes that children can have.
And the reason I came here is that I thought I could operate anywhere else in the country, and I think I can do a good job, but I could not advance the field in the research aspect.
It is an extraordinarily compassionate, caring group of people that works at this children's center. There's nobody that doesn't really care about kids here.
Not only are we committed to making it the best place tomorrow, but we're committed to making it the best place 5, 10, 15, 25 years from now.